Bismillahirrahmanirrahim. Today is my topic in pharmacology, the classification of drugs. So drugs are classified in many ways. ड्रग्स आज का जो टॉपिक है फार्माकोलॉजी से रिलेटेड है, क्लासिफिकेशन ऑफ ड्रग्स। तो ड्रग्स को जिस तरह हम जानते हैं, इट इज़ ए केमिकल, मे बी नेचुरल और सिंथेटिक, विच इज़ यूज फॉर द ट्रीटमेंट, mitigation, diagnosis, or help in the eradication of infection, etc. So drugs are classified English. Drugs are classified in many ways. They are classified either according to their chemical structure, having the basic structural group. Having the basic structural group maybe carboxylic acid, alkyls, amines, sulfides, amides, etc. Or maybe according to their mechanism of action, or maybe according to their uses, or maybe according to their effects. So first of all, according to their chemical composition or chemical structure, drugs are classified in many ways. According to the chemical structure, or according to the uses. Number 3, according to the systems. To the body systems. And according to their mechanism of action. According to the chemical structure, according to the uses, according to the body systems on which they act, according to the mechanism of action by which process the drugs act. So first of all, with the examples, according to the chemical structure. Drugs are chemicals, so there is a lot of groups and classes of chemicals. I will tell you some example. I told you some example. For example, sulfonyl ureas. Is a group of anti-diabetic drugs. Sulfonyl ureas, they are a group of diabetic drugs which are used in the treatment of diabetes mellitus. They are also called oral hypoglycemic agents. Example given, glibenclamide. Second example, example given, aminophenols. It is a group of analgesic drug. Example given: para-acetoaminophenol, या paracetamol, para-acetoaminophenol. For example, salicylates. इसका एग्जाम्पल है एस्प्रिन और एसिटाइल सैलिसिलिक एसिड. A lot of examples are there. Example given of Zikains. Example given is pyroxicam. So, according to the chemical structure, they are sulfonyl ureas. Sulfonyl ureas are used for the treatment of diabetes mellitus. Aminophenols, example given paracetamol or paracetaminophenool. It is an analgesic drug which is used for decreasing or palliative care or prevention of headache, etc. Salicylates, it is an analgesic agent, aspirin and acetyl salicylic acid. Oxycams, they are also analgesics and non-steroidal anti-inflammatory drugs. This is also non-steroidal anti-inflammatory drugs. But chemically they are called salicylates, oxycams, aminophenols, sulfonyl ureas. A lot of examples are there. केमिकल स्ट्रक्चर के बुनियाद पे हम ड्रग्स को इसलिए क्लासिफाई करते हैं कि अक्सर क्लिनिकल स्टडीज़ में और केमिकल स्टडीज़ में ये देखा गया है कि जिन ड्रग्स का केमिकल स्ट्रक्चर एक दूसरे से मिलता जुलता है, उनके फार्माकोलॉजिकल एक्शंस भी एक दूसरे से मिलते जुलते हैं और उनके एडवर्स इफेक्ट्स भी एक दूसरे से मिलते जुलते हैं और उनके यूजेस भी एक दूसरे से मिलते जुलते हैं और उनका मैकेनिज्म ऑफ एक्शन भी एक दूसरे से मिलता जुलता है. और अक्सर ये भी देखा गया है कि एक ड्रग्स केमिकल स्ट्रक्चर तो उसका सेम होगा, दो ड्रग्स का उसमें थोड़ा बहुत डिफरेंस होगा, लेकिन एक केमिकल स्ट्रक्चर में कुछ बुनियादी तब्दीली करने से एक ड्रग की एफिकेसी या तो बहुत ज़्यादा हो सकती है या बिल्कुल कम हो सकती है, या उसका एडवर्स इफेक्ट बहुत ज़्यादा हो सकता है या बिल्कुल कम हो सकता है. और उसका फार्माकोलॉजिकल एक्शन या तो मतलब है कि एक डिजीज़ के बजाय वो मल्टीपल कंडीशन में इस्तेमाल हो सकता है, और या उसका इस्तेमाल जो है उसकी जो एफिकेसी है वो कम हो के उसकी टॉक्सिसिटी बढ़ सकती है. तो इस बुनियाद
बीटा पैराक्सिकैम और लॉर्नॉक्सिकैम,
हाँ, और केमिकल स्ट्रक्चर चेंज करने से अब बाज़ औक़ात ड्रग्स की जो एफिकेसी है बढ़ना या जो घटना है, उसके बाज़ औक़ात किसी ड्रग की एब्जॉर्प्शन ज़्यादा हो सकती है, कभी कम हो सकती है, कभी उसकी डिस्ट्रीब्यूशन बॉडी के अंदर यानी उसका जो पूरा फार्माकोकाइनेटिक प्रोफाइल है वो भी चेंज हो सकता है. तो इस बुनियाद पे ड्रग्स जो है मेडिसिनल जो केमिकल स्ट्रक्चर ऑफ ड्रग्स है, केमिकल स्ट्रक्चर ऑफ ड्रग्स, इसकी जो स्ट्रक्चरल एक्टिविटी रिलेशनशिप है ना, उसको हम कहते हैं SAR, स्ट्रक्चरल एक्टिविटी रिलेशनशिप. स्ट्रक्चरल एक्टिविटी रिलेशनशिप इसको बोलते हैं SAR. किसी ड्रग का जो स्ट्रक्चर है, बेसिक केमिकल स्ट्रक्चर, उस ड्रग की केमिकल एक्टिविटी से या फार्माकोलॉजिकल एक्टिविटी से उसका क्या रिलेशन है, उसको हम बोलते हैं स्ट्रक्चरल एक्टिविटी रिलेशनशिप और SAR, एंड इट इज़ ए टॉपिक ऑफ मेडिसिनल और फार्मास्यूटिकल केमिस्ट्री. तो आगे जाते हैं. तो सेकंड जो है ड्रग्स क्लासिफिकेशन अकॉर्डिंग टू देयर यूजेस. ड्रग्स क्लासिफिकेशन अकॉर्डिंग टू देयर यूजेस. So basically, drugs may be used for beneficial purpose or harmful purpose. For example, poisons. Poisons, they damage the body. Drugs may be poisonous and may be non-poisonous, but actually every chemical having a chemical activity will show its effects, maybe negative effect or positive effect. So according to their uses, drugs may be used for the treatment of pain, which are so those drugs which reduce the pain, they are called analgesics. Drugs may be used for eradication of infection from the body, they are called antimicrobials. Those microbes which cause infections, they are called pathogenic microbes. So we use drugs according to the antimicrobial activity, maybe against the bacteria which are called antibiotics, maybe against the fungi which are called antifungals, maybe against the viruses are called antivirals or retrovirals, antiretroviral drugs. Some drugs do not eradicate the bacteria, but just pause or stop their replication. So they are called bacteriostatic, and those drugs which kill the bacteria, they are called bactericidal. So on that pathway, drugs may be antifungal. So antifungal may be fungicidal or fungistatic, etc. So drugs may be used for treatment of hypertension. They are called antihypertensive drugs. Drugs may be used for treatment or stopping or prevention of diarrhea. They are called antidiarrheals. Drugs may be used for stopping or cessation or slowing down the process of inflammation and allergy. So they are called anti-allergics. Mainly the class involved in anti-allergic, they are also called antihistamines. Drugs may be used for eradication or expulsion of worms from the body. They are called anthelmintics. So this is the way in which we classify the drugs according to their uses. Drugs may be used for treating the gastrointestinal disorders and acidity. They are called antacids. May be used for treatment of obesity and decreasing the blood cholesterol level. They are called anti-hyperlipidemics, etc. So many ways are there. Analgesics are drugs. Analgesics, drugs which decrease pain, which provide analgesia, analgesia also for decrease pain. Example given, they are called different. We will classify these analgesics in the chapter of analgesics and non-steroidal anti-inflammatory drugs. So analgesics are drugs which decrease pain. Antihypertensive drugs decrease hypertension. Antihypertensive drugs. They decrease high blood pressure. Decrease high blood pressure or hypertension. Antihypertensives, analgesics, antibiotics, antimicrobials. Used against microbial infection. Used against microbial infection. So analgesics are further divided according to their chemical structure and according to their mode of action and according to their efficacy. Maybe strong anti-inflammatory, weak anti-inflammatory, moderate anti-inflammatory. Antihypertensives are further divided according to the part on which they act. May act on blood vessels, may act on heart, may act on kidneys, etc. Antimicrobials, they are used against microbial infection. They are further divided. May be used against bacteria, viruses, fungi, etc. And they are further divided. May be used against tubercular infection. May be used in leprosy. May be used in
Gram positive, gram negative.
gram negative, gram positive structural activity relationship. Again, it is applicable here. Number 4, intermediates. Expel worms, expel or kill worms, body worms. They are intermediates. According to their uses, may be antiseptics. Antiseptics applied on skin. Applied on skin for sterilization of skin.
Contraceptives.
Example given इसका है, an example given
Iodine.
pyodine solution, iodide iodine. Example given iodide iodine. To the body systems. According to the body systems. The body systems, drugs may act on the gastrointestinal system. Drugs may act on the cardiovascular system. Drugs may act on the genitourinary system. Drugs may act on the skeletal system. And drugs may act on the skin, etc. Cardiovascular drugs, gastrointestinal drugs, treatment of vomiting, diarrhea, etc. They are used for treatment of hypertension. They are used for treatment of hypertension, angina, CCF, congestive cardiac failure, CCF, gastrointestinal drugs used on skin. For example, given moisturizers, treatment of eczema, bacterial and fungal skin, treatment of bacterial and fungal skin infections. Drugs acting on the respiratory system. They may be used for treatment or help in the expulsion of sputum. They are called expectorant. May be used for treatment of cough. They are called antitussives. May be used for bronchodilation in asthmatic patient. They are called bronchodilators. And may be used for treatment of allergic respiratory diseases. They are called anti-allergics, etc. Treatment of cough, expulsion of sputum. So those drugs which are used for treatment of cough, they are called antitussives. And those drugs which are called for expulsion of sputum, they are called expectorants. And treatment of asthma, bronchodilators. etc. This is the according to the body systems.